They perform some of the most complex medical procedures in this country, and they're burning out. We're talking about doctors who perform transplants, for example, doctors who conduct very specific cancer treatments. And with a major backlog of patients needing precise care, there's no sign of the trend letting up. Joining me with more is the scientific director of Queen's Cardiopulmonary Unit, Dr. Stephen Archer. Good morning to you.
Good morning. Thanks for having me.
So, Doctor, a survey published in June found 76% of academic physicians, some who perform these complex procedures, they're burning out. Why is that now, despite the worst of the pandemic being over?
Well, I think it's complicated, but I think it can be lumped under the general heading of moral distress. So this is a very busy healthcare system we live in, and it's an ecosystem, and that ecosystem is made up of academic health sciences centers like Queen's University and others. But then there are partners in community care, family medicine, nursing. It's all part of a big system. And right now that system is in a lot of distress with unprecedented levels of patient trying to access the system and unprecedented shortages of nurses and allied health professionals. So it makes it very difficult to be a doctor. And I think doctors are aware when they're unable to provide the care they want, buried under a mountain of work, they feel this moral distress of failing the patient, and that translates into unhappiness in themselves. And that affects about 60% of physicians, more in younger doctors, a little less in older doctors.
I want to ask you about patient care. What concerns does this trend of burnout raise for the quality of care patients could be receiving?
Well, I think I can reassure the public the quality of care in general, apart from waits, which is an issue, is reasonably good when you actually get looked after. But it certainly has big issues for access that we all worry about. And no one can deny in emergency rooms and in family medicine offices, there's a real problem getting access to care in a timely manner. And that ripples right through to the hospital. And of course, academic health sciences centers are where Canada has chosen to put most of its high-tech medicine. That's where the future doctors of Canada are educated. It's where research is done. And so when the clinical house is not in order, then all those other missions, which are really important for the future, sort of go to the wayside a little bit. So I think your care that you get when you see us is safe and professional, but doctors, I think, are feeling the burden, and there's a lot of workarounds and a lot of advocacy that's going on just to make sure you get the health care you need.
In Canada, many of the complex medical procedures we know are done outside of hospitals and academic health sciences centers. Those centers also conduct research to develop new treatments, new cures. What effects are the problems you describe having on those research functions?
Well, mission one in the healthcare system is you, the people of Canada. So our job is to look after you, and we take that very seriously. I think that's weighing on people. So needless to say, like if you look at Kingston Health Sciences Center, for example, we have a total of about 200 patients that the medicine department looks after every day in hospital. And with COVID, what's happened is you have the doctor that is on call for that ward. He or she is looking after 35 patients. So already services are too large. But then we have to have a backup call schedule because people get sick, and then we have a backup to that call schedule. So these poor doctors are often not even supposed to be working, and they're being called as the backup. So other things go by the wayside while we try to make sure that clinics are kept open and for in-person visits, which we've done here at Queen's throughout the pandemic. We've been here seeing patients, and the hospitals are run. And we certainly, people like me that try to do research, are doing the best we can to make sure that research also happens.
We have about 20 seconds left, so what can we do here? What's the solution?
I think the solution is we have to acknowledge how we got here. There was sort of a big lie in Canada. I'm not sure who told it, but we believed we had too many doctors, too many nurses, and too many hospital beds. All of those things are false. And we have to acknowledge the new generation of doctors doesn't want to work 80 hours a week. There are more people having children and working shorter work weeks, which is appropriate, but we need to staff our system for that. So we desperately need more of those people, and we need more hospital beds because it's a myth that medicine is done only on the outpatient basis. A lot of it's done in specialized academic health sciences centers.
Dr. Stephen Archer, we appreciate your insight and your time. Thank you.
My pleasure. Thanks for having me.
Hey, thanks for watching. If you liked this, be sure to subscribe here, or you can check out more Your Morning videos right here.